to the Megan Claire Show. I'm a breast cancer survivor, patient advocate, and your host, Megan Claire Chase. I am working with Ancora AI to help share their mission, which is to give unbiased and comprehensive information for patients to empower and bring vetted clinical trial options to all patients. Now, today's show will feature medical adherence and the difficulties that patients have with staying on treatment, more specifically in regards to oral chemo. So I am excited to have Allison Watkins with us today. Allison has a Bachelor of Science in Nursing from Notre Dame of Maryland University with 25 years of experience as an oncology certified nurse and certified in chemotherapy and immunology. I can never say it. No, immunotherapy. Yes, I can never say it right. Plus, she's a breast cancer survivor. Hello, Allison.
Hi, Megs. I'm so glad to be here today and talk to you.
I am thrilled. So before we get started, let's go ahead and get your disclaimer out of the way.
Right. I just wanted to talk today and let you know that I'm speaking from my own experience as a 25-year registered nurse and chemo, biotherapy, and immunotherapy certified oncology nurse. And in no way do I represent the views of my employer or any oncologist I work with. I'm speaking from my personal experience.
All right. So, Allison, do you think that healthcare professionals understand why some patients struggle with medical adherence in regards to oral chemo?
I think that has become a growing issue in recent years with the development of so many new oral chemo and biotherapy, as well as immunotherapy agents. And we're learning to sort of navigate this with the patients as they become more and more prevalent in care. And barriers to oral chemotherapy compliance are really variable and complex, and sort of revolve around a lot of issues involving the patient, the education, and the follow-up by the provider.
So tell us a little bit more of what you see when you have a patient and they are on an oral chemo. Of course, the type depends on whatever cancer that they have. What type of schedule do they have to be on? Why is it so much more difficult for oral chemo patients as opposed to those with infusions?
Well, with infusions, you're typically coming into an infusion center where the care is provided for you. Not that you're not taking responsibility for your health. There's certainly a lot of education that needs to be done on side effect management and things to do to keep yourself healthy during chemotherapy. But when you're on an oral agent, it's really up to the patient to self-administer the drug at home. And some of the barriers revolve around the patient's emotional state of mind, their goals of therapy, their understanding of the goals of therapy. Also, just understanding how the medication is taken. They're all different. Some are really complex. Some of the oral therapies for some of the blood cancers and myelomas are sort of on-off schedules. Some need to be taken with food, some without food, some at certain times of day, while others, for instance, like one of the breast cancer oral chemotherapies is like a daily pill that's like 3 weeks on, 1 week off. And that's a lot easier to manage with like a chemo calendar, follow-up calls, and some education. And some of them are really complex. And depending on the patient's emotional, social, and physical state, as well as how well the providers explain to the patients how to manage the side effects, what to look for, what's concerning, because a lot of patients still aren't really realizing that they are getting chemotherapy because it's a pill, right? So they're thinking, oh, in the morning I take my metoprolol for my blood pressure and I take my medication for my breast cancer. I'm trying not to use a brand name. And go on about my day, not realizing that it is chemotherapy, that it can cause systemic issues because it does target rapidly dividing cells within the body. So you still do have the nausea, the vomiting in some cases. You still do have the neutropenia where your white blood cells can drop and make you much more susceptible to infection. So there's still things you need to be watching for, such as, fevers, chills, cough, all kinds of different things. So depending on how well the providers explain to the patients what they need to be looking for in their initial teach, and then it's really important to have someone following up with that patient, like right away, the first day they get the medication, within a week. We sometimes bring our patients back after a week just to see them in the office, draw their blood, see how they're feeling, if they're taking the medications correctly.